I'm Dr. PK from Dr. PK Live. This video is about multiple myeloma. What is multiple myeloma? Multiple myeloma is a blood cancer that starts in plasma cells, a type of white blood cells made in bone marrow. Plasma cells normally produce antibodies to fight infection. In multiple myeloma, one abnormal plasma cell multiplies uncontrollably. It produces large amount of abnormal antibody called M protein. It crowds out normal blood-forming cells. It damages bones and kidneys. It's a serious issue. Myeloma affects multiple body organs. We basically look for something called CRAB, acronym we use. CRAB means you will see calcium level being high because plasma cells cancer, they break down the bone and causes high calcium. So C for CRAB, C means high calcium. R is renal damage because high calcium causes and a high level of M protein causes kidney failure. So that's CR. A is anemia, it causes fatigue and weakness. And B is bone lesions, causes bone pain and fracture. So we look for CRAB, calcium, renal damage, anemia, and bone lesions, CRAB. Who is at risk? People more than age 60, slightly more common in men, more common in African ancestry, and people with a history of MGUS, monoclonal Gammopathy of undetermined significance, MGUS. How we diagnose it? Clinical picture, labs, and bone marrow evidence. Blood test will have anemia, calcium level high, creatinine will be high, showing kidney damage, and serum protein electrophoresis will show M protein, myeloma protein, and free light chain assay. Urine test, we look for something called Benz-Jones protein light chains. And bone marrow biopsy, more than 10% of clonal plasma cells confirm the diagnosis of plasma cell cancer, that is a multiple myeloma. Imaging, X-rays, MRI, PET scan, we are looking for lytic bone lesions. There are different stages of myeloma, and staging are based on beta-2 microglobulin, albumin, LDH, and genetic abnormalities, and they are used to determine prognosis and treatment intensity. What are the treatment? Treatment depends on age, fitness, and stage. Initial therapy is a combination regimen including proteasome inhibitors, immunomodulatory drugs, and steroid, dexamethasone. Other one is a stem cell transplant for eligible patient. Autologous stem cell transplant can lead to long remission. Then there's a targeted and immunotherapy, monoclonal antibodies, and CAR T cell therapy in advanced cases. Supportive care, bisphosphonates to strengthen your bone, hydration to protect your kidney, and treatment of infection and pain management. Is multiple myeloma curable? Currently, it's considered treatable, but not fully curable. Many patients live more than 10 years with modern therapy, and survival has improved dramatically in last 20 years. When should you suspect it? Consider evaluation if patient has persistent unexplained back pain, anemia without clear cause, elevated total protein on blood tests, recurrent fractures, unexplained kidney dysfunction. So multiple myeloma is a plasma cell cancer of the bone marrow that affects bones, kidneys, blood count, and immune system. Early diagnosis improves outcome significantly. Thank you for watching. I'm Dr. PK from Dr. PK Live.